My diabetes numbers were way up. I was like a 9.2, and I did want to go on insulin. And my blood pressure, I take so many meds because I had fallen and had a head injury. So I was on so many meds. My goal was to reduce my meds, and that is really my goal, and to get more healthy because I couldn't walk. I had no energy, just totally out of shape. I had a horrible gut. I mean, I had IBS, diverticulitis, couldn't go anywhere. That was one of my main things. I couldn't go anywhere without knowing where I could stop. I felt like the commercial on TV where the man's got to know where he's got to go before he gets there, because if there's not a restroom that I know of, then if it was long period in between, I did not want to go because I was afraid I'd get sick. And it was also embarrassing. My goal was to get a healthy gut, and that in turn would help my diabetes and help my blood pressure and help my overall health. And it has. I mean, I've cut my blood pressure medicine. I've cut my diabetes medicine. I have more energy than I've had, and I can't even remember when. And I still want to get more, but it is so much better. I'm so happy that I found this program because I couldn't have done it by myself. This way, I had somebody who could help me walk through it. It's so difficult for me to think of doing it and not know where to start. So having someone to help me through it and take care of me, then that cinched it. I had to do it. And I'm so very glad I could. I've noticed that my head is thinking clearer. And after a brain injury, that's a big thing. I think clearer. It's a little bit easier to manage things. I've gone places. I went to Canton. I hadn't been to Canton in years. I didn't even think I could attempt going. But I went to Canton, and I've just done things, and I feel so much better. Main thing is my gut and that makes my whole body, my whole being feel better. I've gone down in size in clothing, and that's been really nice. And I have got off some medication, which was my goal. So I've done more than I thought. I knew I could do it, but I couldn't do it by myself. Could not do it by myself. I want to continue to reduce some of my medication. I'd like to get off my diabetes medication if I can, but reducing all my medication is the major thing. And then getting more energy. My cousin, Mary, she told me about y'all, and she was having good results. So I was impressed, and I thought, if she can do it, I can do it. And I dove in, and it worked.